Bismillahirrahmanirrahim. Today we are going to discuss the zinc metabolism. And before discussing the zinc, I must tell you the definition of the trace elements. Trace elements are those components of the diet which are essential, which must be taken in the diet, but in small amount, like in milligrams per day or in micrograms per day. Now, for zinc, it is the third most abundant trace element in the body, and it is required for proper functioning of the cell metabolism. More than 300 enzymes, metalloenzymes, require zinc for their biochemical actions. And it has got not only zinc itself is an antioxidant, but it is being required by a number of enzymes which have antioxidant property, which detoxify the free oxygen radicals. Zinc is a requirement for the enzyme DNA polymerase and RNA polymerase, and that's why it is being required for the process of replication and transcription. And you know that for the new cell to be formed, replication and transcription are is a requirement. Beside this, zinc is required for growth, gestation, and the prevention of a number of disease processes. It has also been required by a number of glands to release hormones and for the transmission of nerve impulses. Now, when the dietary zinc is consumed, 30 to 40% of that dietary zinc is absorbed from the GIT, mainly from the duodenum, and that absorbed zinc, 30% of that absorbed zinc goes to the bones, and approximately 60% of the absorbed zinc is required by the skeletal muscles. Pancreas also need a fraction of this zinc for the release of hormone insulin from there, and approximately 5% of that zinc goes to the skin. Now, this slide will give you the more elaborate explanation of absorption and distribution of zinc within the human body. The total body zinc amount is 2 grams. The daily requirement of zinc is approximately 10 milligrams per day, and as I told you that only 30 to 40% of the zinc is absorbed from the GIT. The rest is being excreted out in the feces. So you can see here that approximately 9.6 milligrams of that ingested zinc is lost in feces. Approximately 5.7 milligrams is daily absorbed from the GIT, which goes to the plasma pool. And in the plasma, it is mainly bound to the albumin, alpha 2 macroglobulin, and certain amino acids. As I told you earlier, 30% goes to bones and 60% goes to the skeletal muscle. So you can see here that out of 2 grams of the total body zinc, 1100 milligrams is present in the soft tissues, in the muscles and the bones, and approximately 105 milligram is being there in the liver, which is there required because liver is the hub for the all metabolic pathways. A fraction goes to the hair and the sweat gland, and a very interesting thing is there that you can see around 0.4 milligram of this zinc is lost in urine. So you can see here that 10 milligram, approximately 10 milligram is consumed. Out of that, 9.6 milligram is being lost in feces and 0.4 milligram. So intake of zinc is equals to the output. One interesting fact regarding zinc is that a high amount of zinc is present in the prostate, and we will discuss the zinc content in prostate in the coming slides. This picture shows you the variety of food which are rich in zinc, and among these we have oysters, beef, animal meats, pumpkin seeds, bone meal and broth, eggs, avocado, vegetables, among those that beets, carrots, and nuts. Now remember one thing, zinc which is being taken from the animal sources is absorbed more efficiently as compared to the one which is being consumed from the uh, region. As far as the absorption of the zinc is concerned, it is mainly absorbed from the duodenum. And as I told you earlier, vegetables are less promptly absorbed than the animal sources. Like all trace elements, this zinc require a protein that is called as metallothionein for transportation to the circulation. If you recall, for iron transport we need transferrin, for copper we need celluloplasmin. So similarly, the zinc require metallothionein for its transport into the circulation. A number of factors can enhance or can interfere with the absorption of zinc from the GIT. A high dietary intake of dietary fibers like phytates can impair its absorption from the GIT. Then those minerals or trace elements which are cation, which have two positive charge, they can compete with the absorption, compete with zinc for absorption from the GIT, like copper, calcium. So these both competes and they decrease zinc absorption from the GIT. But small peptides and amino acids, they promote absorption of zinc from the GIT. Zinc. Zinc is a requirement of metalloenzyme. There are two type of enzymes, categories of enzyme. One are called metalloenzymes and one are called metal activated enzyme. Metalloenzymes are those categories of enzyme which require metal ions as an integral component of their structure. These metal ions or trace elements are present in the active site or the substrate binding site of the enzyme. So zinc is a requirement of carbonic anhydrase. If you recall, carbonic anhydrase has a role in the maintenance of pH of blood. Alkaline phosphatase, alcohol dehydrogenase, lactate dehydrogenase, carboxypeptidase, and the most important enzyme which has a role in the detoxification of the free oxygen radical, that is the superoxide dismutase. We have three different type of free oxygen radicals: superoxide, hydrogen peroxide, and hydroxy radicals. And nature have defense mechanisms against these free oxygen radicals. These free oxygen radicals are being continuously produced within the body as a result of normal metabolism, and as well as when we are exposed to sun rays, ultraviolet rays, or X-rays, the free oxygen radicals are produced. So body continuously detoxify these free oxygen radicals, and zinc is a requirement of this enzyme superoxide dismutase. Zinc itself is an antioxidant and it has got an anti-inflammatory action. The two important enzymes that are called DNA polymerase and RNA polymerase. DNA polymerase is required for the process of replication, that is the copying of the formation of daughter DNA from the parental DNA, and transcription is copying of DNA in the form of various RNA molecules. RNA polymerases require proteins which are called transcriptional factors. These transcriptional factors, they require zinc, and these transcriptional factors, they facilitate the binding of the RNA polymerase to the DNA strand which is supposed to be undergo transcription. So in short, we can say that zinc is required in the genetic makeup of every cell. Zinc not only a requirement of a large number of enzymes, but it is being used as a drug in a number of disorders. Zinc is very beneficial in treating acute infantile diarrhea. Infantile diarrhea, infants are those which are from the age of day 1 to 1 month. So those infants, newborns, which suffer from frequent diarrhea, zinc has a benefit in controlling those diarrheas. Then there is a genetic disorder that is called as ectodermatitis enteropathica, and zinc supplementation can have a drastic response in treating this disorder. It can be used as a preventive measure in those patients which have age-related macular degeneration, so they can be prevented from blindness. So zinc has a role in prevention of blindness in patients of macular degeneration. Zinc is also has a role in as a treatment of common cold. Now, zinc is a trace element, and we know one vitamin, that is vitamin C, is also being claimed to treat common cold, or it improves the condition in when a patient suffering from common cold. Now, zinc supplementation decreases oxidative stress markers and generation of inflammation both in young adults and elderly subject, and this is proven. Beside zinc role as a metal cofactor for metalloenzymes and as a treatment in various disorders, zinc has a role in boosting the immunity of the individual. As far the immunity regulation is concerned, zinc helps immune cells to mature, and these mature immune cells then they are able to produce antibodies, and these antibodies they have an ability to go and fight off bacteria, parasites, fungus and viruses. Now the zinc is also required for the function of these different type of cells like neutrophils. You know, neutrophils are required for the phagocytic function. They remove the unwanted antigens, foreign materials or cell damaged cells from the circulation. Then we have two type of cell, that is called T cell and B cell. T cell has a role in the cell mediated immunity and B cell has a role in the humoral immunity. So, and we have a class of cell which are called natural killer cells. So these T cells, B cells and natural killer cells, they also require zinc for their functioning. As far as the healing and repair is concerned, we know that in the healing and repair process, a new cell is to be generated. And for new cell generation, we do need the active role of DNA and RNA polymerases. So DNA synthesis is required, and we know zinc is a requirement as it's a metal cofactor for DNA polymerases. And zinc is also able to produce the proteins that create a structure or backbones for collagen, for soft tissues and muscle tissues, so that it helps to replace the dead cells, and it has a role in healing and repair process. Now while going through the list of various enzymes, we discussed about the superoxide dismutase. And we know we are subject to continuous production of free oxygen radicals, and especially RBC is a source of hydrogen peroxide production as a result of anaerobic glycolysis. So superoxide dismutase is required to detoxify superoxide radicals into hydrogen peroxide, and then hydrogen peroxide are then detoxified to water and molecular oxygen. So zinc is responsible. Superoxide dismutase, you know, almost all enzymes are protein in nature. So zinc is responsible for initiating this protein and keeping the body's detoxification system working. Besides the superoxide dismutase, it is also required for the activity of a protein which is called zinc finger protein. Now this is a structure of zinc finger protein. Zinc finger protein is actually a protein which has an ability to bind nucleic acids. So any of a class of nucleic acid binding proteins and which contain one or more zinc binding domains is called zinc finger proteins. These zinc finger proteins are mainly present are the component of the transcriptional factors, and you know I told you earlier that these transcriptional factors they facilitate the binding of RNA polymerase to the DNA strand which is supposed to be transcribed. This figure shows you the superoxide radical, which is a free oxygen radical, and it is being detoxified by an enzyme that is called as superoxide dismutase. Now here you can see the arrow is showing you that this enzyme requires three trace elements: copper, zinc, and manganese as a cofactor for this enzyme, so that the superoxide dismutase detoxify this superoxide into hydrogen peroxide. Still, hydrogen peroxide is a free oxygen radical, and it is hazardous for the cell membrane and cell itself. So it needs to be further detoxification by the enzyme catalase. Catalase is a heme requiring enzyme, and we know heme is a combination of iron with the protoporphyrin 9 with the help of enzyme that is called as glutathione peroxidases. So catalases, peroxidases, and superoxide dismutase, these are the enzymes. They are the natural preventive enzyme. These are the mechanisms which are nature has provided us by to prevent from these free oxygen radicals, and ultimately we see that these free oxygen radicals are detoxified to water and molecular oxygen. So by this way, zinc plays its antioxidant role. Now, beside the role of zinc as a component of metalloenzyme, its role as an antioxidant, its role in various treating disease processes, it has many other functions, and especially as far as this hormonal function are concerned. Uh, it is responsible for the release of testosterone. Testosterone is a sex hormone, and it has a role in the development of secondary sexual characteristics in males. And as I told you earlier, that prostate has a high content of zinc. That zinc in the prostate is required for spermatogenesis. So testosterone responsible for secondary sexual characteristics, and it also has a role in spermatogenesis, and zinc is required for this process of spermatogenesis. Thyroid gland also needs this zinc for release of hormone from the thyroid gland. And as I show you picture that in pancreas require insulin, pancreas requires zinc for release and storage of insulin, as well as the hormone, this is anterior pituitary hormone prolactin secretion, requires zinc. As far as the neurological functions or brain function are concerned, zinc is required for the taste acuity, for night vision, for intact memory, and for cognition. In hematological section, it is a requirement by the coagulation, certain coagulation factors, and it also has a role in the mineralization of bones beside vitamin D, vitamin K, and calcium. So in short, what are the benefits of consuming zinc? Zinc is required for skin health, for gut health, for eye health, for hair growth, for wound healing, to fight infection, for proper immune function, and for it supports various neurological functions. Now, what could be the possible reasons for zinc deficiency? Number one is that is a poor diet. The diet which has been consumed has a less content of zinc in it. Or stress also decreases the body's zinc stores. If an individual is consuming a high content of dietary fibers, then it also impairs the zinc absorption from the GIT. Any disorder which is related to the absorption from the GIT can also affect the absorption from the GIT, so it can be malabsorbed from the GIT. Fungal infection of the GIT can also interferes with the zinc absorption. Alcoholics are subject to zinc deficiency, maybe because of the poor diet or because of many other reasons. And we also know very well that calcium, being a mineral having a cation 2 positive charge, it competes with the zinc for absorption from the GIT. And there's a genetic disorder, an autosomal genetic disorder, which is being named as acrodermatitis enteropathica. This disorder is because of the deficiency of a protein whose gene is mutated. I will discuss this disorder in coming session. So far, we discussed the various causes of zinc deficiency. Now, what happens because if there is a zinc deficiency due to any of these reasons? Definitely, the zinc will not be available to serve its antioxidant function. There will be high levels of free oxygen radicals, and these free oxygen radicals mainly first attack the cell membrane. In the cell membrane, the unsaturated fatty acids, the lipid bilayer, which is made up of phospholipids, the unsaturated phospholipids are the target of these free oxygen radicals. They will do lipid peroxidation and they will gain access to the interior of the cell. When these free oxygen radicals reach to the interior of the cell, they can cause destruction of the cell protein, they can cause DNA damage. And when the DNA is being damaged, what will happen? The DNA repair, cell cycle, and the apoptosis. These all will be, these processes all will be blocked or they will be impaired. Now, what will happen? The zinc deficiency, and we know that zinc has a role in boosting the immunity. And we also know that the neutrophils, T cells, B cells, and natural killer cells, they all require zinc for their proper functioning. So what will happen? Number one, that the DNA is being damaged, cell repair, apoptosis, cell cycle, they all are being arrested. Similarly, the phagocyte will be unable to perform their function, so there will be impaired phagocytic function. The number of lymphocytes will be decreased. Immunoglobulin production, which is a part of the humoral immunity, will also be compromised, so there will be decreased immunoglobulin production. The ratio of T4 to T8 cells is also decreased, and the production of interleukin 2 is also decreased. Here is the outlines of the effects of zinc deficiency. What will happen? There will be retarded growth or growth will be impaired. Wound healing will not take place or there will be poor wound healing. Skin will be affected and it will be present with the bullous dermatitis. Immunity will be compromised and particularly T cell function is compromised, so the individual is more prone or susceptible to infection. There will be loss of scalp hair. Individual is subjected to night blindness. There will be GIT disturbances will be observed. Cognitive, memory, all functions, nervous functions will be impaired, and there will also be an impaired carbohydrate metabolism. Now, as I told you earlier, that prostate has a high content of zinc, and what here we will discuss the role of zinc in male fertility. Male is fertile when it has developed secondary sexual characteristics. It has a normal amount of spermatozoa and which are mobile. So zinc is found in high concentration in sperm, and this zinc is vital. It is required for the formation of outer layer of sperm as well as its tail, and tail is responsible for the mobility of the sperm. So whenever there is a zinc deficiency, this deficiency will be associated with the decreased testosterone level, and there will be oligospermia. The sperm count will be decreased. So as we discussed earlier, that a release of testosterone requires zinc. So testosterone is for secondary sexual characteristics, and in prostate, spermatogenesis and mobility. So Secondary sexual characteristics will be delayed, as well as there will be oligospermia. So whenever exogenous systemic zinc is administered in these individuals, the sperm count will be increased and motility will be improved. So supplementing zinc in the diet can re-establish testosterone and sperm count levels to an acceptable level. This figure surrounds the effect of zinc deficiency on various tissues and organs. The effect of zinc deficiency on brain will affect that there will be decreased nerve conduction. The patient will present with the neuropsychiatric disorders and neurosensory disorders, and there will be mental lethargy. As far as the thymus gland is concerned, its development is arrested, and there will be thymus will be shrunken, so there will be thymic atrophy. Zinc deficiency will be manifested on skin by various type of skin lesions, and there will be delayed and decreased wound healing, and there will be acrodermatitis. As far as the reproductive system is concerned, especially in males, it will be responsible for the male infertility. There will be retarded genital development. There will be testicular atrophy. There will be hypogonadism. And as far as the systemic symptoms are concerned, there will be overall growth retardation. Immunity will be compromised, and the individual will be highly susceptible to any kind of infection. Here we will discuss the clinical features with which the patient will present to the doctor with varying degrees of zinc deficiency. If there is a mild deficiency of zinc, the individual will present with the depressed immunity, impaired taste, acuity, and smell. He will give you, he will complains about that he don't feel any taste or smell of a food or any perfume, and there will be start of night blindness, onset of night blindness, and decreased spermatogenesis, means the number of sperm count will be decreased. There will be oligospermia with the mild zinc deficiency. If there is a moderate deficiency, then it will be manifested by growth retardation and delayed puberty. The testicular descent will be delayed, or there will be testicular hypertrophy and hypogonadism in the male. There will be rough skin, poor appetite, mental lethargy. There will be delayed wound healing, and now with moderate deficiency, patient might complain of night blindness. In the mild, we have seen that there will be onset of night blindness. As far as the severe deficiency of zinc is concerned, then it will affect the immune system badly, and there will be severe immune suppression. Patient is subjected to all kind of infections, and he or she will present with the bullous pustular dermatitis. When the GIT is affected, he will present with the diarrhea, and there will be loss of scalp hair. Acrodermatitis enteropathica. It is an autosomal inherited disorder of zinc metabolism, and here the gene which codes for a protein and which is responsible for zinc absorption from the GIT is defective. So the zinc absorption from the GIT is defective in this disorder that is called as ectodermatitis enteropathica. The level of defect is at the gene level. Type of pattern is autosomal recessive. So though the dietary intake of zinc is sufficient, but the absorption from the GIT is impaired. So the patient will present with the sign and symptoms of mainly affecting skin and GIT. That's why it is called as acrodermatitis enteropathica. As far as the skin manifestations are concerned, there will be erythematous and vesiculobulous dermatitis. Loss of hair, loss of scalp hair, eye disorders like that is the night blindness, GIT effects will be manifested by the frequent diarrhea. There will be severe growth retardation, delayed sexual maturation. When we say delayed sexual maturation, means the level of testosterone decrease, proper secondary sexual characteristics will not develop, the descent of the testes will be delayed, there will be hypogonadism, and it also affect the cognitive and the memory functions of the brain. So there will be neuropsychiatric manifestation. And since the immunity is compromised, the immune system, both the cell mediated and the humoral immunity is compromised, so the individual will present with the frequent infections. As far as the treatment is concerned, zinc in a dose of 3 milligrams per kg per body can replace the sign and symptoms, or can improve the sign and symptoms of this genetic disorder that is called as acrodermatitis enteropathica. So this disorder is related to the deficiency of zinc in bone and of metabolism due to the defect in the at the gene level. This picture shows you a patient, newborn child, infant. Infant is a child of a day 1 to 1 month, and you can see it is being it's a full bloom picture of ectodermatitis enteropathica, and you can see moistly erythematous plaques which are present not only on the cheeks but also on the buttocks. And if we just concentrate that skin manifestation on buttocks, you can see the symmetry. They are typically symmetrical in presentation. So these skin manifestations in case of acrodermatitis enteropathy. Now, those individuals who have those not individuals, rather we say that infants and young children which have a frequent episodes of diarrhea, zinc has a very important role in treating those acute diarrheas. So when the zinc is being supplemented in these children and infants, it not only reduces the severity of the diarrhea, but it also decreases the duration and the number of episodes of diarrhea, and it also decreases these diarrheal episodes within a time period of 2 to 3 months. So zinc is being a therapeutic agent, a drug of choice in treating acute diarrhea in uh, infants and young children. Now this figure covers the involvement of all those systems and tissues which are subject to deficiency of zinc. When there is a skin is involved, it may manifest with the acne, eczema, and dermatitis. When the vision is as far as concerned, it will present with the night blindness. As far as the immune system is concerned, that's susceptible individuals, they are at a high risk of infection, and that can cause death infections. GIT involvement will present with the diarrhea. Central nervous system involvement will present with the depression. And failure to thrive is actually a condition where the young infant or young children are at a risk to die. In adolescent, both the men and women, they are subject to infertility. They cannot conceive, infertile. It will also lead to loss of bone, because it is we know that zinc is required for the bone health, and it is required for the mineralization of bones. And as a result of delayed wound healing or slow healing, the soft tissues are subjected to injury. So this picture encompasses all those systems or tissues which are affected when there is a deficiency of zinc.